Hi, Miss Lovell.
Hi.
Hi, my name's Zach. I am a nurse practitioner student. I'm going to be doing an exam on you today, if that's all right.
Yep.
Okay.
Sounds good.
Great. If you will, stand up for me.
Okay.
Perfect. Turn this way. Good. I'm just going to take a look at your spine. Okay, everything looks good. Look at your gluteal folds. Your iliac spine looks symmetrical. Do me a favor and just take a few steps towards this way, if you will. Good. And back towards me. Good. Very good. Gait is normal. Looks steady. Now one more time. Walk that way on your toes. Good. And then walk backwards to me on your heels. Perfect. Very good. Very good job. Okay, now if you will, just have a seat here. And actually, yeah, just sit right there. I'm going to listen to your heart and lungs, if that's okay.
Yep.
All right. Sit here next to you. You just relax. I'm just going to listen to your heart.
Okay.
Perfect. All right, very good. Nice and regular.
Okay.
All right, now take a deep breath for me. And out. Good job. And another one. Perfect. Now do me a favor and just slide your legs that way. Perfect. All right. Now I'm going to listen to your lung sounds here. Another deep breath. And out. Good. Another one. Good. Another one. Good. And another one. Good. And one more down here. And the last one here. Perfect. Miss Sarah has a thin shirt on, so that's the reason I'm not listening under her skin. Okay, Miss Sarah, let's do this. Go ahead and lay on down for me.
Okay.
And we're just going to take a look at your right hip. It's been bothering you lately?
Yeah, it's just been giving me some trouble. I feel like it's getting worse.
Okay, sure. So what I'd like to have you do is first we'll go, actually, let me feel on your stomach first. So no abdominal pain, correct?
No.
Good, just some light palpation, no tenderness there. Good, a little with deep palpation. Don't feel any enlargement in your liver or your spleen. I'm going to palpate your femoral arteries. Good, those are all good. Listen for bruise into your femoral arteries. Good. All right, sounds good. All right, now what I'm going to have you do is with your right leg, actually let's start with your left leg. So start with the good leg. If you'll do flexion, perfect, good, and now extension, good, and no pain, good. Okay, let's do your right side. A little bit, does that hurt a little bit?
Yeah, a little bit.
Okay, and with extension, very good. Now let's do it with passive, again, no problem at all. Good, and then we'll do your right side. Good, a little bit more there, sure. But good range of motion. Now what I'd like you to do is you're going to do abduction of your right leg. So just move it out like this and then back towards you. And that hurts a little bit. Okay, and we could do the same for this to your left side. Abduction and then adduction. No pain, correct. Very good. The next thing we can do is test your strength. So if you will, lift this right leg up against my hand. Okay, good. Hurts a little bit though. And then push down on me a little bit. Okay, good. Give her strength to 4 out of 5 on this side. Let's do the knee as well. So go ahead and try to flex your knee again. Good. And then down and resist. Good. Again, 4 out of 5. Let's do the same for this leg. Good, and down, good, and then go ahead and lift, yep, good, and down, perfect. The next test that's more specific to the hip would be the Faber test with a B. Would be flexion and abduction of the hip with external rotation. So we're going to externally rotate here. We're going to put a little bit of pressure on the opposite side of the iliac crest here and push down. She has some tenderness there. Also going to do the Fader test, which is adduction and internal rotation here. And it has a little bit of pain there. Okay, so those are both positive. Let's do the other side. So we'll do here and push on the opposite. No problem there on the left. Good. And then the Fader test is here. And internal rotation. Good. Very good. I'm going to also palpate the pedal pulses here. Both are good and strong, 2+. I feel me touching you. Sensations intact bilaterally. The next thing I want to do is have you sit up.
Okay.
We'll test your reflexes. Just kind of dangle your legs here. Test your patellar reflex. Good. It's adequate. And this side, same. Also going to test the Achilles reflex. So put a little tension on the Achilles. And then look for dorsiflexion there. Or extension, excuse me. And then same for this side. Okay, good. Very good. With the Fader test, you're looking for labral tears of the hip, also hip impingement. With the Faber test, you're looking for things such as bursitis, osteoarthritis, also hip impingement, and which is positive for both. Thank you so much, Sarah. Thank you for your time. Appreciate you.
Oh, thank you.